It's my feel-good breakfast show.
Inderdaad, jou goed voel ontbytprogram. Welkom terug, Expresso op SABC3. We are live and of course in the midst of Women's Month, and today we're placing particular focus on the health issues faced by working mothers that are often overlooked. Now last year, leading pharmaceutical company Pharma Dynamic conducted a study on the state of working mothers' mental health, and the results showed that the pressures of having it all are driving many moms out there to the brink of nervous breakdowns. And we're joined this morning by Pharma Dynamic spokesperson Mariska van Aswegen as we delve deeper into this topic. Thank you very much for joining us. How are you?
I'm good, thanks. How are you, Kat?
Fantastic, fantastic. So, I mean, I think that's the expectation from society, that working moms are supposed to have it all, be able to do it all, be a super mom, take the kids to school, cook, and then still work on top of that as well. But what are some of the consequences that, you know, mothers go through, and in terms of what they feel like emotionally, not being able to do it all?
Kat, I think you summed it up. Everything that a mom has to do in today's day and age, the work responsibilities, home responsibilities, taking care of the family, all those stresses are just sort of magnified by feelings of guilt. A lot of these women, working moms that took part in our survey, reported that they have feelings of guilt, of wanting to do it all. So they want to have a career, but they want to be there for their children as well. And they often lie awake at night, you know, stressing and having anxiety attacks about that, and wondering if their children will resent them one day for wanting to have the best of both worlds. And that added to the daily stress of keeping up with work and with home life responsibilities are getting to most of the working mothers out there.
Yeah. I think we should just start realizing that being a mom in the first place is a super job, you know, and then forget everything else. Be more helpful around the house. But with this poll that Pharma Dynamics did, you surveyed 900 working mothers across the country between the ages of 25 and 55. What are some of the results that you found?
Kat, I think you just named it, that being a mom is one of the most difficult jobs in the world. And I think these women confirmed that, because about 40% of them said that they spend more than 80 hours a week on work and home responsibility. So it is quite devastating to think how much time they really spend on looking after their families, and then also contributing to the financial benefits of the family. And then about 60% of the moms said that they do have to spend time after the kids has gone to bed, after they've completed their family responsibilities, on catching up with work over in the evenings or over weekends. So that puts a lot of stress on working moms out there.
And how does this manifest itself in terms of the health issues that are faced by working moms?
The majority of the women who took part in this survey reported that they started to experience at least one health issue since they started working, or when they became a mother, when they were working. And you know, these issues that they have mentioned include, for instance, headaches. More than 50% reported insomnia. They chronic fatigue. Changes in their eating habits, so it increased weight gain or weight loss, etc. And then more than a third of the mothers then also reported, you know, for instance, increased incidence of depression, for instance. And the important thing is that prolonged periods of stress in our lives actually has been linked to anxiety and depression. And it is important for us to take note of these health concerns, because it's not only important for mom to be there, but it's important for you to listen to your body and to then take action sooner rather than later, because it does increase the risk of suicide, it does increase the risk of substance abuse, for instance, and that's why we want to raise awareness about the risks associated with trying to be there and be it all for everyone.
Yeah, absolutely. Now we're going to continue our discussion with Pharma Dynamic spokesperson Mariska van Aswegen, and I know that there are many women out there who want to share their stories and their opinions with us. So if you're watching with us, please, right now, you can of course join the discussion on Facebook, or you can join our Twitter poll, and we look forward to hearing from you. Right now, let's take a look at the latest news out of the tech world.